Hi, my name is Olga. I'm going to be performing the skills video of subcutaneous injection. For the skill video, we need our medication vial, syringe and needle, 2 alcohol wipes, pair of gloves, and gauze pad. For this injection, we're going to need a 29 to 30 gauge half-inch needle, 1 milliliter syringe. Due to supplies, I'm going to be using this one. Next, I want to go over the 6 rights of medication: right patient, right medication, right drug, right dose, right time, and right documentation. And then I want to check the computer and the EHR against MR 3 times before giving any medication to my patient. So this is going to be my first time doing so. Patient is going to be receiving heparin injection. The dose reads 1 milliliter over 1,000 units. So patient is going to be receiving 1 milliliter of that. I have the calculation dosage right here, nothing in the back. It reads calculation 10 milliliters over 10,000 units, times that by 1,000 units over 1, and it's going to be equalizing to 1 milliliter. I'm going to set this aside here. Next, we want to go ahead and gather our supplies here. I want to knock, enter, close the door behind me to avoid any HIPAA violations. I'm going to set my supplies here on a clean, dry surface. And I'm going to go ahead here, hand hygiene, and introduce myself to the patient. Hi, Mrs. Smith. My name is Olga. Can you please verify your first name and your date of birth? As she does that, I'm going to verify her wristband. This is going to be my 2 patient identifications. Do you have any allergies today, a seasonal medication or food allergies that we need to be aware of? No allergies? Okay, perfect. This is going to be my second time verifying against MR. All right, Mrs. Smith, so the reason why I'm here is your doctor has prescribed you an injection here. I have an injection ready for you. I'm going to get ready for you. Your injection is called heparin. This is anti-coagulant. Basically, it prevents blood clots. Most patients receive this if they're going under surgery or through an IV. In your case, you're going to be getting that because of your DVTs. Some of the side effects that might occur is you might feel like bruisiness or like a discoloration there or anything like that. Please let me know if it prolongs or gets worse, or any cuts that won't heal. And then also there is some adverse reactions. We do not want them to occur, so please let us know as soon as possible. Adverse reactions could be blood in the urine, stool, or also you might have shortness of breath or anything like that, just bruising that won't go away. Please let me know and I will notify your physician as soon as possible. Do you have any questions for me? Before any questions, I also want to let you know you might feel any stinginess and burniness. That is normal due to in the injection. All right, any questions? No questions? Okay, awesome. So this is going to be my third and last time verifying against MR. I'm going to put hand hygiene here and put on my clean gloves. And we're going to talk about the site. So there are 3 locations that my patient can be receiving the subcutaneous injection. It could be the upper arm, it could be the thigh or the abdomen. Due to rotation, my patient wants to receive it in the abdomen, which is left or right side, just above the rib cage here, just below the rib cage, sorry. And it's going to be right here on my patient. Next, we want to go ahead and get the medication vial ready here. Vial ready. We're going to clean up the top. We're going to discard that. We're going to clean it up. let that air dry, and we're going to get the medication ready here. So I'm going to take this out, and we're going to be using a 29 to 30 gauge half-inch 1 milliliter syringe. We want to hold this as a pencil, needle pointing up and cap still on. We're going to inject air of 1 milliliter. One milliliter of air. Next, we want to go ahead and use these 2 fingers, and we're going to take off the cap. We're going to go ahead and push in the air. We're going to invert and draw up the solution to 1.0 milliliters. We want to tap if there's any bubbles, in case there's no bubbles. We're going to take this out, and in this case, we're going to use the 1 scoop method. Go ahead and close it here, and I'm going to show you guys. So it's 1.0 milliliters. Show the camera here. All right, perfect. That is ready to go. Next, we want to measure. We're going to pinch the skin here and measure that our needle size, starting from the top fold to the bottom fold, is half the size of the needle, which it is. And we want to go ahead and assess the site, that there's no infection, no bruising, no swelling, no infection. And also we want to palpate to make sure that there's no edema or any tenderness, which there isn't. Next, we want to go ahead and take our alcohol wipe here. We're going to start from the center, going outwards 2 inches out. We're going to we're going to have that air dry over here. I'll discard that. Air dry, and we're not going to touch that area. Next, we're going to go ahead and start with the injection. We're going to grab that. That is all air dried. We're going to take off the cap. We're going to go ahead and pinch here with non-dominant hand, dominant hand. We're going to go at a 45 to 90 degree as a dart quickly. I'm going to release that pinch, grab it over here, dominant hand. We're going to inject. We're going to slowly take it out. We're going to put this in the sharps container immediately. We're going to take our gauze pad here, gently, and not massaging it or anything. I'm going to take it out. No sign of bleeding, so no need of Band-Aid. We're going to next discard everything that is needed in the trash, put this in the medication vial. We're going to take off our gloves, throw them in the trash. We're going to hand hygiene, and we're going to document our results.